And we just had an event last night, an evening at L's. It was a 5-course prefix menu, and it was absolutely delicious. And they're actually going to do it for us every 3 months, so we'll have another one in January. But coming up next Saturday from 5 to 8 p.m. at Austin Food Company, which is off of Barton Springs, they're going to make their whole menu vegan, oil-free, and it's kind of like a Halloween party, so we encourage you to come dressed up as a fruit or vegetable if you would like, or whatever you choose to be for Halloween. So again, that's 5 to 8 at Austin Food Company next weekend, October 27th. And then after that, every month going forward, we started it for the first time this month, and I know a lot of you were there, but at Zyka Indian Contemporary Cuisine, every second Sunday of the month, from 6 to 9 p.m., they're going to be doing a vegan oil-free buffet for us for that entire time, and we can push the tables together, and it's kind of just a fun way to get to know people. And then going forward, we're going to kind of keep it at that event for a little while. That way we can kind of build things up, and if you have any ideas of restaurants that you want to go to, feel free to let me know, and I can do the work of contacting them, or if you want to contact them yourself, you're welcome to.
Great. Thank you. You're awesome. And let me introduce our speaker. Joyce Hale actually flew here from Cleveland, Ohio, to tell her story to us. I'm very grateful for that. And the first time I actually heard of her was on a podcast a few years ago, on Mended Paths podcast. You told your story, and I remember I was out running, and I had to stop a few times because I just couldn't believe it. I was like, wow, you know, somebody's entire life, they're sick, and just the power of, she just shows, and you'll hear it today about how when she changed her diet, she was able to heal herself from such a long-term destructive illness. So I'm very excited to hear her story.
Everyone's awake now. It's fantastic. Thank you for having me, and I'm surprised that that's how you heard of me from the Mended Path podcast. That was in fact a couple of years ago, so I thought your timing might be off. And for coming here, this was actually because of Sarah Shannon finding one of my posts online, and she reached out to me, and a few weeks later she happened to be in Cleveland, Ohio with her buddy Susan, and they were at Cleveland Veg Fest. They found me at the booth I was working at for the day, and I thought they were joking when they asked me to come down here. So lo and behold, it wasn't a joke, I'm here, and I'm really appreciative not only of that invitation, but of the generosity of the people here in this group for this past weekend. I know the weather wasn't ideal, but we definitely had a great time getting to know each other, and dinner last night was fantastic. You guys have a great town, and I'm blown away by your group. So as I mentioned, Sarah did ask me to come and share my story, and in doing so, as Patty indicated, it is a long journey, so I'm going to try and talk fast and get this through for you guys. But what I really have to do is start at the very beginning, and that is to say that I was sick my entire life. And I don't mean that figuratively, literally from the day I was born, with 103 fever and measles. So I feel bad for my mother, because normally in a speech like this, the picture that would be on here would be something that represents that moment in time or that period of time. And unfortunately, my brother, sister, and I found out a few years back when my parents passed that there are no pictures of me from that day. There's not a birth announcement. There are not pictures of me in the hospital being held by family members. In fact, there are no pictures of me for the first year and a half of my life. And I think in today's time that would be a little bit different. There would be a GoFundMe page, there would be specialty Facebook pages, but back then it was a little bit different. And someone just described to me that they think that that might be the fear of losing that child would make it difficult for them to want to document that. So what happens is, getting out of the hospital, people start looking for either a cause or a label to explain what happened. And in this case, they might have first gone to trauma. My parents were in a car accident with me when my mother was 8 months pregnant. And although she was wearing her seatbelt, she was thrown into the windshield. So that would make it very easy for them to explain why I was born so sick. So in that case, sick or not, maybe not taking pictures, but at least grateful that they were able to carry the child to term. Unfortunately, as time went on, I ended up developing or inheriting the label a sickly child, because I didn't grow out of what might have been assumed as a traumatic illness, but now a chronic illness as a child, constantly sick, missing school. So then of course people are questioning, do I like school? Do I want to be there? I loved my teachers. I received good grades. So I wanted to be there. I was just so sick. I was so miserable. I was exhausted that sometimes I just couldn't manage to leave the house. Over time, you start questioning, is there a label when it goes into teenage years? Is there such a thing as a sickly teen? Could it be potentially growing pains? The only thing is, this wasn't what was typical growing pains or what they considered growing pains. I had weird illnesses that just didn't make sense. In fact, I had a procedure done when I was 12 years old that normally was a procedure that would be done on women much older, that had started their cycles, who had possibly even been pregnant. And here I was a 12-year-old having this procedure done on my reproductive organs. This wasn't growing pains. There was something different that was happening to me. And unfortunately, this led into my adult life too. So is there such a thing as a sickly adult? No, it just becomes a chronically ill person. But I still didn't have a diagnosis. In fact, when I went away to school, I spent so much time in the health center having blood work done that one of my dance instructors came up to me and questioned why I was so pale, why I was so ill looking. And I had to explain to her my little secret that I was spending almost every day at the health center having blood drawn, and that there were all these symptoms going on with my body that no one could understand, and this had pretty much gone on most of my life. This was the first person in my life that looked at me as a whole person and voiced a concern of what was going on with my whole body. Not the one symptom that this doctor worked on, or not the one that they did this procedure, but there was something going on with my body, and she voiced the concern, can a body really endure what I had described to her, let alone the amount of blood they were taking from me every single day? She certainly knew I wasn't going to be able to continue with my dance classes being that sick and ill. So this particular phrase that people use of the apple not falling far from the tree, more often than not, that describes a mannerism. It could be likes and dislikes. It could be even just facial features that go within your family. But what was happening while I was off at school and having all these tests run, I found out that my mother was at home going through her own mysterious illness. And she was developing growths all through her legs that needed to be removed constantly. Some were tumors, some were cysts. They gave them all different kinds of names. But her body was developing these growths throughout her legs and sometimes further up into her body. And at one point, the growth started turning into infections and solidified her legs. And the doctors told her that she would have to have one of her legs partially amputated. And my father was adamant that this was not happening to his wife. So without Google, without the internet, my father started doing some research and found that there are things you can do internally to your body that can heal it. So much like on the outside of our body, we always had vitamin E and aloe for any wound care. He started doing that internally with my mother, literally having her drink gallons of aloe vera juice. So I thought it was really interesting that he could prohibit her from having that surgery, keep her from having to go on awful meds, and literally save her leg and potentially her life at that point in time. Little I knew that I was going to need that information later on in my life. At that time that's going on with her, they're still looking for a cause or reason for me, what's going on. So that meant I was still undergoing many, many tests, and I was seeing many, many specialists, and none of them are coming up with anything. So what unfortunately happens with an autoimmune person, not only do they go through all of this, and it takes a long time to understand what's happening, they're typically told it's all in their head at some point. And there was a hospital in Pittsburgh that basically wrote into my medical chart that they didn't think anything was wrong with me. And the reason they didn't think anything was wrong with me, because the doctor walked in my room and he said, I'm thinking about taking out your appendix. I think it might work. And in my head, I had always thought when they were taking out an appendix, you were supposed to be told you had appendicitis and we need to take it out. Not I think it might work. So I asked him, what if it's not my appendix? Are you sure? He's like, I'm not sure, but I'm willing to try. I wasn't willing to try because I said, but what if it doesn't solve the problem? Then we'll have to keep digging. I wanted something a little bit more definitive, so I demanded to be released from the hospital, and I went back to Cleveland, where my parents were, and within 3 weeks I was undergoing emergency surgery for numerous growths that I was now growing inside of my body. So it wasn't all in my head, he just wasn't running the right tests, and he was very quick to jump to a conclusion of extracting one of my organs, albeit one that can be removed and you can still function, but I just wasn't comfortable with that, so it certainly wasn't all in my head. And this is when they start looking at family history. Unfortunately, they couldn't connect the dots between my mother and me of what was going on with her and me, because there were different body parts. So instead of looking that a body is building growths, they look at hers and her legs, mine in different areas, and they never connected the dots that her and I were going on the same path at the exact same time. So differential diagnosis is what really comes into play here, and what I love about differential diagnosis, it reminds me of the great TV show in the early 2000s of House. I loved Dr. House. I loved watching this show because every week there was a patient that would come in with a mysterious illness that nobody could understand. This was me. And I loved knowing that there were other people in this world that weren't freaks of nature, that they really had these medical mysteries that do in fact happen and stump doctors. So what I also like about this is, if anyone was really familiar with the show, there was this common thread that went through when they would be up against a wall. Somebody on his team would throw out, maybe it's lupus. His response was always, it's not lupus, it's never lupus. Except for in one episode, it really was lupus. And that throws them off. Because now what do? Well, I didn't know anything about lupus, much like what my father was doing with my mom. I didn't have the internet. In fact, I didn't even have a computer when I got the diagnosis. And the unfortunate thing, my parents had already passed before this point, so I'm doing this on my own. I really would have loved to have my dad's research skills with me at this time. But I did a little bit of research on my own, the old-fashioned way by going to a library, and I needed to find out what lupus was. And what I found out when I would tell people I had the diagnosis, they would say, I've heard of it, but I don't quite understand it, and that's very common. So I needed to find a way to explain it in terms people could understand, which becomes a cartoon. Basically, my cells, my antibodies, cannot distinguish my own tissue from a foreign invader. It thinks that my own cells are a foreign invader and attacks it. So no matter what my body tries to scream and like, don't hurt me, it's going to attack itself. So a normal normal immune system is going to be more like on the left side, where when there's an antigen that comes in the body, whether it's bacterial, whether it's viral, whatever the case may be, your body's going to take the antibodies and attack that bacteria or that viral infection, whatever the foreign invader is. In an autoimmune patient, you're on the right-hand side, where some of those may or may not get to the bacteria or the viral, but they're definitely getting to its own tissue, they're attaching to it, and they're attacking it. That sounds bad in itself, but the next part is that the body sends a signal that says, we didn't get that foreign invader, we need to send more. So there it comes in when a flare comes for an autoimmune patient, a flare comes in for a lupus patient. And it is systemic. So I know there's a few people in this room that are familiar with lupus, and they talked to me beforehand. It can attack any part of your system. So some people have only heard of maybe the skin, or maybe the central nervous system. It's the entire immune system. It can be skeletal, it can be muscular, it can be endocrine, it can be reproductive. 12-year-old without even starting my cycle, and I was already having issues with my reproductive organs. Basically, for every flare, it may not be the same. So a lupus patient can have a flare that involves their skeletal system. Their next flare could be their endocrine system. It can be any organ in the body. And it's basically like a pinball machine inside of you. Basically, I was told by one doctor that I could have a sunburn on my hand and my kidney could be attacked. So it doesn't even have to be in close proximity. It can be a free-for-all inside the body. And here was the most difficult part for me to learn, that there's not a cure and there's not a dedicated treatment plan. So with every organ involved and with all the different symptoms that can happen from flare to flare, what the doctors do is they just find different medications that are out there that are designed for symptoms for a different illness that may have symptoms similar to what that patient is enduring at that time. So they give them that chemical, and oddly enough, as we've all seen the ads on TV, all these really great side effects all come into play. And you're also putting those chemicals into a body that is already confused, has difficulty distinguishing what is supposed to be there, what's not supposed to be there, and you're just throwing a bunch of chemicals into that body. And as all these side effects happen, they give you another drug. So a lot of the patients that I know that have lupus, they end up with these beautiful cocktails that they're taking every single day. And the pharmacists that I have met have basically said they're incredibly frustrated when they see this and concerned, because there's not a pharmacist that can look at that many medications and determine what kind of interaction is going to happen, let alone putting it in a body that is already so in a dysfunctional state. But wait, here's the really cool part. There is hope. In March of 2011, new drug came out on the market. It was the first drug approved for lupus in over 50 years. Man, did they hit the market with this. There were all kinds of campaigns letting people know that this drug was out here. Fortunately, this is where I'm going to take a Sharpie to the bottom part of the page where it says it's the first drug developed specifically for lupus. It actually was not developed for lupus. The studies were for another similar type of illness. Wasn't doing well in that study. Said that it looked like lupus patients were reacting well enough to it, so we'll put it on market. So here comes Benlysta, the big savior for lupus patients. It's first FDA-approved drug in over 50 years. We're excited about this. Targets a growth factor, these B cells that are part of the immune system. It's immune cells, it's targeting that, and it's administered with a monthly IV infusion, going to the hospital, going to an infusion center, put the IV in, and let's go in and kill some of these cells. There were 2 large trials of 865 patients, and what they saw was a reduction in disease activity of 14% versus 9% with a placebo. I have to tell you, when this came out, I did not know that's what their effective rate that went to market. 14% is not much more than 9% of that placebo. In fact, there are some standards out there that look towards 30% effective rate of really promoting those drugs, and this wasn't even half of it. And this was the drug they were putting out on the market. They said it caused a reduction in flare rate and a reduction in the use of prednisone. And most lupus patients, most autoimmune patients are taking prednisone to try and curb the immune reactions. Here's their big however. Again, this stuff was not part of their campaign. The magnitude of the benefit is modest. And I want to say modest as best, but I kind of think that's a typo. It should be measly, because 14% is pretty sad. And it's also not indicated for severe cases. So the severe cases are the people that have kidney involvement and central nervous system involvement. These are the ones that have the most deadly version of the disease, the ones that need the medication the most, and it's not indicated for them, and I had both. And then it's costly. And again, this could be a typo or them not knowing how to use terms properly in their material. Costly is actually $10,000 to $12,000 per dose is what it's billed. Now granted, if you have good insurance, that may take it down a bit, but $10,000 to $12,000 per dose. There are families that have gone bankrupt to try and get this medication for their family members. So it's a monthly infusion, $10,000 to $12,000 per dose. And on top of the first 6 weeks of being on that medication, it's actually every other week, not monthly. That's a lot of money that people are paying for this drug that, oh, by the way, they forget to tell you is only 14% effective, not even meeting our normal standards. And here I am getting my first dose. And yes, I did say that I was one of those patients that should not be taking it, and yet they found a loophole and put me on this medication. So I know that the question is, if you have the 2 things that they say you shouldn't have to take this drug, how desperate must you be to agree to let them put that IV in your arm and do this to you, not knowing what the outcome is going to be? Well, this is how desperate I am. So I had skin involvement. The normal skin involvement that most people see as an outward sign is what they call a butterfly rash. It's across the bridge of the nose, into the cheeks. And it's one of the only outward telltale signs that might be what the patient's dealing with. Makes the patient look like a wolf, which is the term lupus does mean wolf. And I'm not sure, oh, sorry, there's a glare on the screen. For me, the skin involvement actually was open wounds that basically at one point was the entire right side of my face. I was quarantined for a month in order to heal those wounds, to try and avoid infection and avoid scarring. So in order to avoid those things, I had to cleanse the wounds every day and pack it full of medication, which took several hours. So my skin involvement was a little different. Sorry, I jumped ahead here too. Hair involvement. Hair does fall out, whether it's from the prednisone, whether it's from the actual disease, kind of a combination. Mine definitely fell out tremendously. Very short hair. Hairdresser could not keep up with how much my hair was falling out and even it out. So I basically walked around with very uneven haircut. But the more important thing that was discouraging, other than the hair loss, was the amount of lesions I had on my scalp. So the lesions I had on my face were the same ones I had running through my scalp. It can affect the heart, and I definitely had that. I spent a lot of time in the cardiac wing being admitted, and when the cardiologists would come in to see what they were going to treat me with, they would find out that I had lupus, and they couldn't treat me. One, I wasn't their standard cardiac care type of patient. It wasn't a heart condition I had, so anything that they would have treated me for my heart could potentially backfire on my lupus. The hands up, we're not touching this girl, and I got that from a lot of times I was in the hospital and had to wait for my doctor to show up. Lungs. This is probably some of the most debilitating for me personally, because at times I would have multiple respiratory conditions. One time when I was admitted, I had 2 types of pneumonia, which to be honest, I didn't know there was more than one. I had whooping cough at the same time, and I had pleurisy. It was excruciating to breathe, to move, and to function, and I went through that numerous times, having various combinations of those illnesses and being put in the infectious disease ward and quarantined off from my family, friends, and everybody. And just until recently have I only been able to understand how long-term the damage was to my lungs, and I'm now working on that. Kidneys. Like I said, this is the most debilitating. This is typically when you hear on the news like a Selena Gomez having kidney transplant. I think that was either last year or the year before. She's one of those spotlight ones that actually gets the attention in the news, unlike the rest of us that are just your day-to-day people struggling. But that being said, it's good to have awareness. For me, at one point, they were looking at my kidney function. I was sitting between a stage 2 and a stage 3 and looking down the road that I would eventually need dialysis or transplant. The eyes. Eyesight sounds a little minor after some of these other ones. For me, I was a photography major. I had a scholarship, and I lost the ability to focus the camera and see properly. So for me, that was devastating because that was my artistic outlet away from my illness, and I ended up losing that too. And it's the blood vessels. And this makes sense in the fact that, first of all, the blood vessels can be attacked, so there's inflammation with them. They can even rupture. But the blood vessels are carrying the blood and the oxygen to every part of your body. It is vital, so it makes it a little bit more sense how this becomes even more systemic, that not only can the lupus attack all these different organs, but if the blood vessels are involved like mine were, they have a double chance of affecting every organ and every system in my body. And I then did incur central nervous system involvement, and for me it was horrendous neuropathy and seizures. The neuropathy would be at the point where I would sit on the ground and take my legs and bang them on the ground to try and just stop this rapid fire pain going through me. And the seizures became daily, and ultimately they became multiple daily seizures I was incurring. But I'm single, my parents are gone, I need to work, I need to have health insurance, so you work like that, which is not probably the most ideal thing to do, putting someone with seizures behind the wheel of a car and then having them work all day. But the neurologists in Ohio, laws are a little bit different. They said they couldn't stop me from driving until a certain point on my seizures, so they let me go behind the wheel, and I'm sure they were happy that they never on the same path as I was. Cartilage loss. This one actually was probably the most telltale sign for me when a radiologist came up to me and said, there's something going on, and I don't know if you've been working with some doctors to get some tests, but I'm seeing some issues with your cartilage, and I'm not seeing it in one part of your body like a wear and tear. I am seeing it through your whole body. And again, kind of going back to that dance instructor that looked at me as a whole body for the first time in my life, here was a radiologist that wasn't going to be able to give me a diagnosis, that planted some things in my head so I could work better with the doctors, or perhaps the doctors could work better with me. And to be honest, it was within a week of her telling me that I finally did get my proper diagnosis. And then lastly, bone deterioration. I have met a woman in her early 20s that had double hip replacement because of the bone deterioration from her lupus. I have a couple friends in their 30s that have had multiple disc fusions done in their back and their neck. For me, it was a little bit different. It was the entire side of my face disintegrated in the jaw and had to be rebuilt. And I'm glad that none of you guys are eating because I can't stand pictures like this. but it explains to you that this is a free-for-all in the body, and it explains to you how desperate I was to allow them to put that infusion in me when I'm sitting at lunch one day trying to eat my food, and suddenly my mouth won't open to get a fork or a spoon in. And I can't understand what had happened until they explained to me that the way the jaw is supposed to look, and it wasn't a disc issue, and it wasn't TMJ, and there was nothing that conservatively they could do for me. But instead, the condyle there in the center that allows the jaw to articulate had completely disintegrated and looked like a melted ice cream cone. And then on top of it, it had built a ridge, just enough of bone that suddenly hit that point where I couldn't open my jaw. Now, this didn't come on suddenly. This actually came on after 2 years of what I complained of excruciating earaches, excruciating pain on the side of my face that no one could understand. They kept saying that you don't have an ear infection. In fact, you don't have an infection at all. So what happens is when they still can't come up with something for these poor autoimmune patients, they say, well, you have lupus, so this is now part of your lupus. And you're supposed to embrace what they call the new norm. And this is now my new normal, that for 2 years, I dealt with excruciating facial pain, not knowing that my jaw was slowly disintegrating and that I would lose that side of my face. So what you could see from the picture was the side of my head was shaved. They cut from the temple to the bottom of the chin, peeled that all back, extracted rib bone, build a new jaw from that, which I actually think is kind of cool that they can do that and someone figured this out. And then a titanium plate that goes into the face to hold that all together. And it was several months of physical therapy that was necessary for me to learn how to eat solid food again. And the more important thing, how to look and sound normal to you when I speak, because it's not normal to me. And here it is actually 10 years yesterday from my surgery, and it still doesn't feel normal. It is dead weight on the side of my face that feels like someone has put weights in my face that just drag it down. The cool thing about the body is the body learns how to overcome that. So they taught me in physical therapy that I will overcompensate with the temple, the back of my neck into my shoulder, which is always painful, and this side of my face, that is the good side, that will allow this to work properly so I can speak and I can eat. So I thought that was really cool that they could do that with me. However, that is an overwhelming process, and I know that's an overwhelming slide too. That being said, it led me to the path of advocacy. Because sometimes people will say, don't get mad, get even, but I'm mad at my body, so I can't really get even with it because my body's already doing that on its own. So I decided to get involved. And less than a month before my surgery, I was asked to participate in the Lupus Foundation of America walk, big fundraising walk. You know, all the different medical organizations have these walks now. So 1 month beforehand, some of my friends got together with me. I couldn't eat with them, I was basically on a yogurt diet at that point, but I really had a good time, and it was nice knowing that I had the support from these people and that there was an organization that had my back. 2 years later, I was the top fundraiser for the state of Ohio, and there's a reason that there's an ugly cry happening in that picture. It wasn't because they made me literally their poster child on a billboard on the side of the highway coming out of downtown Cleveland, but because they sent me to Washington, D.C. to advocate for patients. So it allowed me to get my mind off of what was happening to me, knowing that I could go fight for these patients all over the country and help get research dollars for these patients and help try and improve their lives. And ultimately, hopefully it would improve mine one day, but in the grand scheme of things, there are thousands and thousands of patients all over the country that need this help. And they also sent me to the state capitol to talk about insurance reform and allowing patients to have better access to their medication. So this gave me something worthwhile to do as I felt personally behind closed doors that my world was falling apart. And then unfortunately, history repeats itself. I'm sitting at work one day, suddenly I can't open my jaw. It is excruciatingly painful. But it's not the side that they did the surgery, it's the other side, the good side, the side that's making the left side work properly. So I call the surgeon's office and I tell them what's happening, and they ask me to come in the very next day. So I take a long lunch, go in, and I go and have my little differential diagnosis kind of conversation with them. They tell me the good news is it's not as bad as the last time they saw me, where I needed to have surgery within a few weeks. The bad news is I would need surgery within a year. And it was really hard for me to understand what was going to happen when they cut through the right side of my face, the side that makes the left side work, because this is all still dead. and it will never repair itself. And they said, we don't have good news for you. It doesn't look good. The outcome is probably pretty bad. There's a really good chance you might not eat solid food after the surgery. There's even a more difficult chance that you will not speak, or at least you won't speak properly. And there's nothing else we can really do for you on that. That's just what's happening to your body. So I asked them, what am I supposed to do? Because I really don't want the surgery. And that surgery was difficult, and the recovery was difficult. So their response was the best thing they could tell me to do was to keep my lupus under control. So here I was in my early 40s, sitting in this office hearing this god-awful news, being told to keep my lupus under control when I hadn't been able to do so for 40 years. And they knew that. They had my history, and I asked them, how do you propose I do that? Because you know I haven't been good at that. And their response is, we know what we're telling you, and we know how awful this is, and there's really nothing we can do for you. And they walked out of the room as I sat there crying. And I couldn't believe that this was happening all over again, but at such a higher level than previous. So then it comes, now what do I do? Well, I'm taking a long lunch for this appointment, so I better darn well get my butt back to work. But I'm going back without good news for my coworkers, without good news for myself, and really letting this weigh on my head. At the same time, I think that earlier that year, while I was dealing with my seizures, someone convinced me to look into a Mediterranean diet, which I had, so I've been dabbling with that. And it wasn't necessarily successful. I felt better, but obviously, symptom-wise, I wasn't doing better. And until I got that news from them, I thought I was doing better, but it's not. But I'm gonna continue doing it anyway, because at least I feel better, and it's gonna help me just kind of do the mind over matter thing. Unfortunately, with trying to absorb all of that and hold it inside, the anxiety and depression that comes with a chronic illness is definitely increasing in me. But it is my job to put on my game face every day, or what I would call my smoke and mirrors, which is good makeup, and a nice cute outfit, and pretend that everything's okay. So literally every day is wake up, pretend I'm okay, and I go to sleep, and then I do it all over again the very next day. In the meantime, here's something really cool that's going on. There's this awesome man in my life named Scott, who has gone through this with me for 4 years. He has gone through ups and downs. He has sent me to specialists. He has sent me to the miracle workers. Unfortunately, they've all failed. But he's a good guy, and he's like every guy that's out there doing their job, trying to fix the girl. Can't put duct tape on it, but he's trying his best. He's also about to turn 50. So I'm excited because I like celebrating someone's birthday, and I love celebrating life. So I'm thinking, milestone birthday, I need to throw him a party, and that will get my mind off of things. Instead of milestone, he's thinking mortality. He's looking at his family history of heart disease, high cholesterol, high blood pressure, everything that goes into that category. So he's kind of a geek and a research guy, and he starts looking into diet. And he finds a doctor in Cleveland through the Cleveland Clinic, a former cardiac surgeon, Dr. Russison, some of you may have heard that name. And he takes his parents to a day-long lecture there. And he comes back from this lecture so pumped and geeked about this guy. Will not shut up about Dr. Russison. Starts talking to me about diet. I remind him I don't have cardiac issues. The cardiologists have explained I don't have cardiac issues. That's not going to apply to me, but you go for it, babe. You do what you need to do. He won't shut up about Dr. Russison. I jokingly accuse him of having a bromance with this man. In the back of my head, I wonder if he's having a midlife crisis, which he could be at that age, you don't know. But more importantly, I need to figure out how to buy this guy a vegan cake now for his birthday. Which, no offense, they were really good. I did cupcakes, and they were vegan and non-vegan. Nobody was allowed to know which was which but him. And they liked the vegan ones better than the non-vegan ones. Just a note there, because I thought that was cool. Unfortunately, through planning that party and also moving beyond that, back in my world, things are still progressing, unfortunately. My neuropathy is worsening, which unfortunately tells me my lupus is worsening, which then I hear those doctors tell me I'm supposed to keep my lupus under control, and obviously my body's doing the opposite of what those surgeons had asked me to do. So I go back to the doctor, desperate, and I tell her I would do anything to stop this because, as you know, I am supposed to keep my lupus under control, and I need to avoid that surgery at all cost, literally at all cost. So she gives me yet another medication on top of all the other medications I'm already taking, still thinking pharmacists hate this, they don't like seeing another medication, but I take it. And unfortunately what happens is it worsens my seizures. Because here's what we didn't pay attention to. One of the side effects of the medication she gave me, on top of all my others, is it leaches the sodium from the body. And for me, I already have abnormally low sodium, that it's similar like a diabetic crash. Will put you into a bit of a stupor, you get confused, you can get extremely fatigued, get weakness, not able to use your arms and legs, pass out, could go into a coma. And this is where I am from a medication that I'm supposed to be taking to lessen my neuropathy, instead of actually made things a lot worse, and the neuropathy didn't get better anyway. And of course I'm sitting there going, damn it, I'm supposed to be keeping this lupus under control, and all I'm doing is spiraling out of control instead. So a woman at my work was devastated to see how many seizures I had one morning, and it was 4 days before my next infusion. And she tells me, I already know from the history of your infusions, if you're this bad, there's a good chance they're not going to give you that infusion, that your body is in such a weakened state that they're going to be terrified to administer this on you. What are you going to do? So I immediately took myself off that medication because I don't need to be leaching sodium out of my body. And I realized I need to start dealing with maybe giving some electrolytes back into my body, get some balance back in. And so anything that's an electrolyte was going down my throat for 4 days. And then I started looking into what I called like all those trends of the superfoods. All those articles were out there talking about them. So I was making smoothies every morning. I'm drinking all the electrolytes in my car. And in 4 days, when I went to that next infusion, I was as strong as I had ever been walking into one of these infusions. Just 4 days had really undone the damage from that new medication. I thought, I can't believe it's something that simple that in 4 days I could make that much progress. If I can do that just with superfoods and a bunch of electrolytes in 4 days, what if what Scott's talking about with diet really would make sense for me? So I went to my next infusion, and I sat with a couple nurses and talked to them about diet. And I said, do I need to be doing this? Should I be following and listening to Scott and doing what he's doing? And instead I was told that the Mediterranean diet was working and that I was winning. And I thought, okay, I've done what you've asked me to do, and I've accepted my new normal. I have a hard time accepting that sitting in the hospital with an IV in my arm, killing off part of my immune system, is winning. This is not something I'm willing to embrace. So I start questioning things, but again, still questioning, I can't embrace this is what people call winning, because I know not one of you in this room would call that winning, and I doubt neither one of those nurses would have called that winning, but for me it was supposed to be winning. So I start questioning things and what I can do better, and I literally throw out there in my head asking for a sign. I need a sign. I don't care if it's coming from mom and dad, I don't care if it's calling from what you believe the creator is, I need a sign, and the universe responded intensely that weekend. I went home to recover from the infusion, and I usually would have to spend the remainder of the day in bed. And there was an ad for Dr. Oz that afternoon. And he was going to have a doctor on there talking about how to stop Alzheimer's in its tracks. I thought this was really cool because my nephew was studying Alzheimer's and genetics, and I thought I would take notes and send him the information, and I'd be really cool and use my downtime wisely. Instead, it was Dr. Neil Bernard talking about what we put in our bodies having such a heavy impact that you could literally stop Alzheimer's from progressing or maybe even occurring at all. And I found it really compelling that it was very similar in nature to what Scott had been talking that Dr. Askeson had said. Not necessarily one and the same, but similar enough that there were two doctors in different fields of medicine that were both looking at the body in the same way. I had never heard of this, so the fact that there were two doctors doing this really blew my mind, until the next day when I put on PBS, and there was Dr. Furman doing the same thing. And so here he is, he's talking about the nutrient density, and I have to say that might have been my aha moment, that nutrient density, putting the nutrients into your body that your body could metabolize and use to heal. Found that very compelling, but I also found it compelling that the entire day it was doctor after doctor after doctor, all talking about how all these different diseases, all these different forms of medicine, that they could all do the same thing and really heal the human body. So fortunately, Scott was out of town, so he has no idea that I've seen all of this, and he's not doing the I told you so dance on me just yet. However, the next day when he comes back, he asks me over because there's a DVD a friend of his had sent him, and about how his father beat end-stage cancer. And it's this video, it's not one of the big mainstream ones out there, but it's healing cancer from the inside out. And what I loved about this was that although it says cancer, these doctors from all over the world were talking about every disease known to man, especially the ones that are so prevalent here in the United States. And they did talk about the standard American diet and why it's so prevalent in the United States versus other regions of the world. And they also talked about why we don't know, why our doctors aren't telling us. So I found this very compelling. Where I went with this was that life whispers and we're supposed to listen closely, which was a message I had learned the year before when I was on a 3-week medical leave trying to get my seizures under control. Did some life coaching. So it had talked about how life does whisper to you, you do get signs, or it can be that gut feeling inside of you, and you're supposed to listen to these. And what you're trying to do is you should listen to it when it's still a whisper, not when it's a ton of bricks on your head, which is usually where most people go, and I know it's where I go. I have to be shaken up, thrown to the ground, and crashed into a brick wall before I listen. So fortunately, that was a gentle way of bricks being thrown at my head that weekend on TV. But here's what was really cool, because this is what I heard. I heard that food is fuel. I heard that food can either be the safest and most powerful form of medicine or the slowest form of poison. I heard why I shouldn't be asking my doctor for this information because she just doesn't know, and it's really not in her wheelhouse. And at this point in time in her career, she probably doesn't want to know and learn anything else. She's looking at retirement. And then I learned that the medical industry, the insurance industry, they're businesses. They don't have the same stake in the game that I do. It's not their body. Whether I get sick, or I get more sick, or I get healthier, they're still making money. And I still have to go home and live in this body. So here's where I took it. If it's meant to be, it is up to me. That they're not gonna do this for me. So I've been given all the tools and resources that I need, and I'm gonna have to do something with it. And then here's the hard part that I had to hear. My boyfriend talked to me about kale. I told him how much I hate kale. I told him, don't you know I have a titanium plate in my face? I can't gnaw on that god-awful stuff. And where it comes down to is that may be what's going to put me back to my factory settings, eating that damn kale that he's talking to me about that's really bitter and awful. As Karen knows, because she was the one that hosted me this weekend, she knows that I eat kale, and I have kale at my breakfast. So kale's not so bad after all. So what really happened then is it becomes time for tough self-love. This is me having that come to Jesus moment with myself, and that is when I ask, how many times have I said that I would do anything to feel normal, to feel better, to stop the progression of this disease? How many times has Scott talked to me about diet? I have made excuse after excuse after excuse why I won't do it, and I've told him flat out no. Even literally, which I divulged to a couple people at the table, I even asked him one time if it was a deal breaker. Fortunately, his answer was much nicer than that question, and we're still together. But, you know, I kept putting up a wall as he would talk to me. And then I asked myself, how afraid am I of another failure? That I won't try this? That I really won't try or do anything like I say I would? Because that fear of that disappointment in his face, or that discouragement and another loss of hope, is so overwhelming that I'm literally just going to fail to even try, as opposed to try and maybe fail. How many bricks have to be thrown at me, and how hard do I have to crash into that brick wall? But the most important was the one when I looked in the mirror and I said, how big of a hypocrite am I? I just told my doctor 2 weeks ago I would try anything. I've told my boyfriend this numerous times, and I won't do it. So I made a vow to myself that I could never utter that phrase again the rest of my life unless I tried this for 30 days. Once I tried it for 30 days and it failed, like everything else had failed, I can go back and I can use that phrase. But if I don't try this for 30 days, never utter those words again. And what was the worst that could happen? So for 30 days, I could eat broccoli. I love broccoli. Broccoli is good. You can make it a bazillion ways. Just don't put the cheese and the butter on it anymore. Quinoa. I heard this term when I was researching all the superfoods. Now I just had to figure out how do you make it and how does it taste good. But really what was most important is it's only 30 days. It's not that big of a deal. And again, if it fails, it fails. But at least I did it, and I feel more comfortable that I'm actually true to myself in the words that I speak. Here's what really happened, and this is the cool part. Within a few days, my coworkers were asking questions and noticing a huge difference in me. So I, of course, told them that I was doing the diet. Their response was, that diet that Scott's doing, you said you would never do? Yes, that diet is what I am doing. Please don't ever stop was their response. Within a few weeks, I was reducing meds and I wasn't having any consequences. In the past, if there were any fluctuations in my dosages, I would have a major setback with my illness because the slightest fluctuation would cause an immune response and cause my lupus to act up. And within 1 month, I was ready for my next infusion and I was feeling incredibly strong. In fact, I was feeling much stronger than I had when I did my superfood experiment. So this was great. But then there was a major setback. The good news is that this wasn't a flare. It's a little bit different. So I have to go back to that slide before. Because where I was on the right, before all of this started, before I tried this experiment, suddenly I was moving towards that left side. I was moving towards normal. In fact, I was building healthy cells for the first time in my life in 40-something years. And what did I do? I stuck an IV in my arm and I killed them off. That would be the setback. So I inherited a new label at this point, and I was a little bit concerned, but when I decided that I was no longer going to do that infusion because that setback was too horrific for me, I was called a non-compliant patient. And these are the things that were said to me. I will get sick. I already was. You need the meds. They weren't working all that great. I'm not a doctor. I know that. I'm not a nutritionist. I know that. And quite honestly, the doctors and the nutritionists weren't doing that much better for me anyway. But most importantly, I was told that I would be dropped by my doctor. And I was told that by someone who works with a lot of lupus patients, that my non-compliance with my doctor's treatment plan would basically have her no longer care for me as a patient. And I was originally just coincidentally scheduled for an appointment 3 months after I had changed my diet. So I called my doctor's office and I moved my appointment to 6 months from when I changed my diet. One, I wanted to show, can I sustain this? Is this really going to continue to happen? But more importantly, I needed to learn the art of wordsmithing before I saw my doctor. I needed to change how I presented this to people in a more appealing fashion, that she wasn't offended that I took myself off of her medications and that I wasn't completely out of my mind for doing what I was doing. So I told her that we were a team, told her that she was no longer alone in this journey, and she was no longer to blame when things failed. So I was actually standing at the plate with her, and this time I was ready to swing for the fences. In fact, she didn't have to swing at all. And more importantly, that now that I'm aware of what this diet can do for my body, I need to be held accountable. So if I slip back into my old ways and I get sick, there's nothing for me to say to her. It's all on me. And probably the most important out of all of it is I have a responsibility to others, and I have to prove that this works. Because much like what I described with my mother having the disease, and obviously she's passed so I can't help her, I have a niece, my goddaughter, the closest thing that I'll ever have to have children, who also has autoimmune, and she's already had a procedure done to her leg, and she's had multiple symptoms, and she has gone through her teenage life asking, am I going to be like Aunt Joyce? So my thought was, I can tell her, yes, you can be just like me. And when you get sick enough and you're ready, I know how to turn that switch off. So I owe her that. So even if I'm not willing to do it for myself, I'll definitely be able to do it for her, because she's worth it. And then it becomes time to celebrate. So a friend of mine says, we're gonna go out to dinner. Now that you're able to go out and do things, let's go have a nice meal. And afterwards, she wants to go out for coffee. I don't drink coffee, I drink tea, and I like a nice tea latte. And the place we went only had dairy milk or soy milk. And I really didn't like their soy milk. It was really gross. So I thought, hey, it's been 8 months. I probably can have this one tea latte. I'll be just fine. No, what happened is my reward that I went out for turned into my own punishment. And for 3 days after having that tea latte, every step I took was lightning bolts flowing through my body, just the most excruciating pain. And basically what had happened is I had woken up my lupus. So I ended up with a new label, and that is that I am the canary in the coal mine, and literally that was what I was called by a group in Cleveland. And basically what happens is there are certain people with diseases like autoimmune that have a hypersensitivity to the inflammation-causing agents and products, dairy being one of the most intense, just because of the condensed nature of it. But what's going to happen is when you do that, the body's going to react and attack itself like it always has in the past. It goes back to what it knows because you awaken the disease. And that these little cheats and indulgences are going to trigger the underlying illness unlike someone that's not dealing with autoimmune, if they have that one time, one meal, one beverage, it's probably not going to be a major setback. Unfortunately, it becomes a very harsh but very meaningful reminder for an autoimmune patient of who they really are and what they have, but more importantly, the power that that food really does have. It's really hard to turn that off once you get that lesson loud and clear. So I went into the new year after that, and I wanted to do some more research. So I started looking at some of the medications I was still on. Even though it was lower dosage, I was still on medications. And there was one in particular that's an anti-malaria medication that I've been on for almost 20 years. It's known to cause some visual issues and disturbances, and it can even cause permanent damage to the retina. That sounds bad enough in itself, but when I started looking back at this medication, I found neuropathy, seizures, and Stevens-Johnson syndrome. Now, I'm going to admit, I read the pamphlet when they gave it to me 20 years earlier. None of those were a concern to me because I didn't have any of them, and they didn't happen right away. These were things that developed over time, and unfortunately, it could be the long duration I was on the medication, or it could be the progression of my illness. The doctors will never know. But when I read that doing the research, I found it incredibly disturbing that I'm on this medication and the most debilitating part of my disease were ones that could have potentially been caused by this medication. So I was vowing myself that this is going to be the next medication I'm working on. But I'm being told that all lupus patients take it. In fact, when I was in DC, there was a panel of experts that talked about this medication and said, all the patients take it, it's good for them. And a bunch of patients, including myself, asked them to explain why. What is it that it's really doing for lupus patients that every lupus patient should take it? And they couldn't really explain anything. So of course we asked why again, and we got nothing. So this really becomes a time when I'm not getting answers from the experts within the lupus field, so I need to seek guidance from new experts. So that year, I decided that VegFest was coming up a couple months after I was having these debates with the doctors and all the lupus specialists. And I went not because I wanted to try all the new foods and see some of the vendors and all the different things that they had going on there, and I'd gone to it before. But this time was a little bit different. There was a speaker that was there that I wanted to see in person. No longer on video was going to be good enough for me to see the speaker. I needed to see the bromance guy that my boyfriend was obsessed with and see him in person. So I went and I listened to his talk, and I sought out that day knowing I was going to meet him, and I literally wore this t-shirt, Carpe Diem. I will meet Dr. Esselstyn in person that day. I will go there. And what happened is I basically climbed over people when he was done from his speech and made sure I was in the front of the line so I could meet him. I shook his hand and I thanked him for saving my life. And his response really threw me back because he said, I don't know what you're talking about. I said, well, all the work you're doing, and that translated indirectly to making its way to me, and that saved my life. And he said, from what I'm understanding, there's not one doctor that worked with you, and you were figuring this out on your own, so you've saved your life. And I have a hard time accepting that because without his work, none of that information gets to me. I stay strictly with my doctors and what they tell me to do. I'm not here. So I get what he's saying, I appreciate it. He has a long line that's formed behind me, so I move along, but there's a woman sitting next to him that looks kind of familiar, but I know it's not his wife. And she throws her hand out, and it is Jane Esselstyn. And she asks me, are you aware of all the research that's being done on autoimmune conditions and plant-based diet? No, I am not. She goes, well, it makes it more compelling that you've made the progress that you've made, and you don't even know that this is happening. So she invites me to an event that she is throwing a little bit over a month later, and she gives me her pamphlet, and I start looking into her company, Healthcare is Self-Care. And I go ahead, reserve a spot at that particular event, and I reserve a spot for my boyfriend too, because I'm going to make him go with me. In the meantime, Dr. Esselstyn gives me a call on Memorial Day. I'm completely geeked out that I look at my phone and I see Esselstyn on there. And it's a holiday, what is he doing? So I use this slide not because it's applicable to what I'm dealing with, because I love his aggressive nature. I love his straight shooting way that he tells it like it is. So in talking to me, he tells me that there's a note on his desk that says, wow, you need to talk to this lady. You need to hear what she has done with her lupus. So he gets very clinical with me, asks me about my kidney function, asks me about all the medications I've taken, and how far along I've come with my plant-based diet. And he seems pretty happy with everything. until he asks me how compliant I am. And I explained to him that I wasn't quite doing everything he does with his heart patients, but I don't have cardiac issues. So there's a little bit there. And the little bit is some sugar in the form of chocolate and some sugar in my tea. And I haven't quite mastered this no oil thing. So straight shooter assistant asked me, why am I still hurting myself? But I'm not hurting myself. What are you talking about? I'm getting better. No, you're hurting yourself, and you know you are. You know that certainly the sugar isn't helping. And I understand that might have some confusion about the oil, but I'm telling you that if you do this, you're going to progress even further than you've been able to do on your own. So I say, okay. He asked me if I'm ready to play hardball. I think I am, Dr. Esselstyn. That's not good enough, Joyce. I need to know 100% you are ready. Yes, Dr. Esselstyn, I am ready. Terrified, but I'm ready. So he tells me that he wants me to report back in 2 to 3 months what my progress may be. And I tell him, well, oddly enough, I've signed up for Jane's event. I'm going to see you next month at the Knob. And he says, well, then you better start working fast because I want my report in 1 month. So I go, there's Jane at the Knob, and there's me right up next to her, up close and personal. And what I found really cool about this was such an intimate setting. I think there's like 25 people that get to come to this event. We get to cook with her. They do different lectures throughout the day. Dr. Esselstyn comes to all of the tables, sits with everyone, and talks to all of the people. But more importantly, here is a room full of people that are all doing what I've been doing. And I feel like I'm this only person in the world that's doing this. I'm all isolated by myself because no one other than my boyfriend is doing this. And here's a whole room full of people that are also interested in maintaining a healthy future, that they're all doing the thing that I've been quietly doing on the side. So what happens here is I find out that there's this whole food, plant-based community out there. There's events happening all the time. And a gentleman that was working at Jane's event is part of a group called Plant-Based CLE. They're having a meeting 2 nights after Jane's event and asked me if I will go. Yes, I will go. I need to meet more people like this. I need to not feel so alone. And because I have this ongoing homework assignment with Dr. Esselstyn, I really need to work hard. Before that meeting, he tells me, if you come a half hour early, we're going to talk about this Engine 2 7-day rescue diet. Book wasn't out yet. There was no Facebook group. This was all just these trial sessions he was doing. He had done a couple times in Ohio. And they're going to do another trial session within a couple weeks after this meeting. So I signed up for it, feeling kind of silly, like, well, I've been doing this for 3 years, thinking this really isn't going to do a lot, but I just kind of want to get more involved. That time you actually paid for the 7-day rescue diet too. It wasn't free. So I paid for it, I did it. I was blown away how much better I did just in those 7 days, even though I've been doing this for 3 years, reaffirming that I needed this community to help move forward. So then I found out that there was a Two Forks food conference, one of the weekend immersions versus the ones they do out in Sedona. It was going to be in Cleveland. Well, I am flat broke. I end up working the event with the Engine 2 group and get to meet more of the community. And a couple months later, Jane does an annual Prevent and Reverse Heart Disease conference and end up working that way too. It's the only way for me to get in the conferences because my budget's just not really going to make it happen. And I'm also now more immersed with these people doing what I need to be surrounded with. So while all that's going on and I'm doing all this network, I'm still continuing this experiment on myself. So the cool thing is, working with Dr. Esselstyn escalated my progress in the drive as he suggested that I get out of my own way, that I was standing in between my goals and getting there just by still having those couple cheats. RIP's Engine 2 7-day rescue actually broke me through this long-standing barrier of me being able to skip a day of meds. While I was on the 7-day rescue, I skipped 1 day of meds. It did not cause a problem. That had never happened. When I had missed by mistake, I paid for it for days. And here I was able to skip a day. So every week I skipped a day, and over time I started skipping 2 days and 3 days. And while I was aligning with these like-minded individuals and these different groups, they helped me find additional research and resources to really help educate me further so that I could not only do this for myself, but I could start helping other patients on their wellness journey. And the cool thing about working with the other patients, it motivated me not to give up, not to fluctuate too much when I got a little bit weak, even though I'm not going to cure my illness. And I have to say that I can't cure my illness because if I did, then the minute that reintroduction happens, I wouldn't have such a major setback. But the more important thing about me saying that I'm not curing it is I got to speak at the Two Forks event. And a gentleman stopped me the next day and said, "You're very different than the rest of the people that spoke." And I didn't understand how I was any different. And his response was, "I have type 1 diabetes, and I go to these things because my wife drags me. I want nothing to do with it, but I love her, so I go. But all these people tell me about them curing their diseases when I know I'm never going to cure mine. So I choose to do nothing, go home and go back and eat the way I do. Because you're the first person that said you can't cure it, but it was worth getting a higher quality of life. It was worth going down this path, even though you'll never cure the disease." And he said that he was now finally willing to try it. And this is when I realized that I can really work with patients and help people break through their barriers and all the walls that they've built of all the things they can't do, and suddenly give them reasons and different things where they can do and succeed. So these are my experiment enablers. Obviously, Jane Esselstyn for opening this door into this community and letting me know that there's something more out there and I'm not alone doing this. Rick, because that Institute diet made all the difference in the world, even more than the intimidating phone call by Dr. Esselstyn, actually doing that structured diet that spelled it out for you, showed you how to put it all on a plate or a bowl, really finally made it sink into me of how far I could potentially take this. Then there's Adam Saad, who unfortunately isn't here today, but I know he's part of your group, but he's traveling. I met him at the Two Forks event, and he practically tackled me when I came off the stage and said, "Oh my God, that was amazing. That was the coolest thing I've ever heard. He's such a sweet, sweet man." And he told me, "You need to be talking to people. You need to be helping people." And that stuck with me tremendously. And then this is when I saw him at Plant Stock a couple months ago. And then Dr. Esselstyn, of course, that phone call made all the difference in the world. But what's really cool about this picture is not just his goofy, smirky smile that he has. This picture was taken at my place of business just over a little bit over a month ago. He came to my work to talk about ending cardiovascular disease. I built a wellness program, and he agreed to come and help educate my coworkers. They loved him so much, but they were freaked out about how do we cook without oil. That Jane came last Tuesday and showed them how to cook without oil. So now she's part of my wellness program, and the tables have turned. And then most importantly, here is Scott. And the cool thing about Scott is not only did he save my life, but he put tons of life into my life. So once I started getting strong and better, I could do all the things I missed in my 20s and 30s. So we go hiking, he took me whitewater rafting, we've gone zip lining. I have this incredible thriving life that really was not in the cards for me in my 20s and 30s, and certainly not the prognosis I had just 6 years ago. So there are some reminders that I need to constantly put in my head that it's okay for me to take control. The first is that these doctors do not live in our bodies. They sometimes don't even really understand what we're going through. They don't understand the pain, the suffering, the mental anguish, the depression, all of it that comes with it. They know the symptoms that they are addressing, and sometimes they can't see it for a whole, or that this is what every day of your life is like. And fortunately, apparently I didn't delete everything on here. So the pharmaceutical companies, they're in business. They have money to make in this, and they are to make chemicals that you are taking. And the hard thing is, I do know that the years of medications bought me time, but they never made me better. They never made me stronger. They certainly didn't make me happy, and they were never making me thrive. But they were important to buy me time until I could figure out how to do that. And the most important thing is that this is my body, and I have the right to take back control of it. So when different doctors may be having a problem with what I'm doing, or just people in general in my life, they don't have to live in this body, and it's mine, and I have the right to do what I want with it. So I have the right to determine, am I putting chemicals in it, or am I going to put some simple plants in it? Obviously, you guys can tell I'm putting simple plants in it, and I'm doing much better, and it's worth taking control of it. And the cool thing about this particular reminder is that it's not just a reminder to myself, but it's a reminder that I use when I start working with patients. When they hear the backlash that they're getting from maybe their spouse or their mom of why aren't you eating what I cooked for you, don't you love me? It's my body. I have the right to try and make it better. And whatever you're making, I'm sure you're making it out of love, but if you really loved me, you would want me healthy, not necessarily eating the food that's going to take that away from me. So here's the cool reminder. Here I am, another day vegan. I have not died yet of a nutrient deficiency. So I know you guys all know that we're asked about our protein, or you're not going to get the nutrients you need. Nope, here I am 5.5 years later, still thriving. And then what's a really cool reminder and celebration is that in doing this, I have continued to progress. I have continued to get better. I have not really had any major setbacks except for in the very early stages. But the most important thing is I finally reached my goal to be 100% medication-free. That happened back in March of this year. That's actually how Sarah found me from my post about being medication-free. And it is the most liberating thing to be able to go through life every single day without medication. And I apparently have a question.
Yeah. Do you still test positive for lupus markers when you do blood work?
There's some variances and a few things. Mine is complement deficiency, is the one that has always been the biggest telltale, and that one I definitely do. Symptomatically, and all the other blood work, no. Kidneys, where I was stage 2 to stage 3, completely normal now. So I've reversed and recovered quite a bit of it, but that complement deficiency, that has not quite gotten there. But in the grand scheme of things, compared to everything else, I'll take that one thing. So after Sarah found me, a few weeks later, so did Forks Over Knives. So they ran my story, and what was really cool about that, not only because I get geeked out about stuff like Forks Over Knives, but because I was already working with patients, and this got blasted all over the world to where I had people from New Zealand reach out to me, Bulgaria, Africa, and the patients I get to work with span the world. And while she heard about my podcast a couple years ago from a gentleman in Canada, there's a woman in Australia that found me, and I did a podcast with her. She beat her MS. She's working on a book, and so I did a podcast with her. So it's really enabled me to have a much greater outreach once I hit that med-free zone. So while it's really cool to have a good outreach, I'm not gonna lie, it's pretty damn cool to not to be on meds after decades of taking those chemicals. And so it really brings me to what most of us already know, and really how all this begins long before any of us were born. And that's the quote that, "Let thy food be thy medicine, and let thy medicine be thy food." It is true. Almost everyone in this room is living it. And it's just amazing that you can spend not 6 months sick and recover, not 6 years sick and recover, but 43 years and still be able to recover from all those decades of damage. So for me, this is really my little mantra, that it's important for me to refocus, it's important for me to refuel, to revive, but most importantly, it's important for me to rejoice. So thank you.
Excellent, Joyce. Thank you very much.
No, thank you.
All right. Does anyone have any other announcements or anything they'd like to share with the group? Or otherwise, you're welcome to hang out for another 30 minutes or so. And if you want to help us pack up, or you're welcome to rinse your plate in the kitchen and just hang out with us for a while. And hopefully we'll see you next week at the Halloween party, or next month before Thanksgiving. Thank you, everybody. Oh, yeah. The Halloween party, that's at ATX Food Company. Oh, at the Kava bar. It's a yeah, it is a little tough there.
I'm exhausted.
Yeah.
I'm so exhausted. And I didn't cry. Every other time I've talked, I've cried. It was the first time I got through it without crying. Okay.
I think because I am now like at that point where I'm still so euphoric that it's harder and harder. Oh my God.
Just making a quick announcement. If any of you would like to share the video from today or last month, invite go to our church Facebook page. Just look for Seventh Adventist Church, South Austin. Okay? Feel free to share as you'd like.